right. Thank you, everyone, for tuning in. We are very excited. My name is James Haslam, and welcome to this month's show of the Traverse, Rights and Democracy Institute's monthly conversation series, where we explore everything from navigating the daily peaks and valleys of the movement to how we think about liberation. Our profit-driven healthcare system has been failing so many of us for so long. This is nothing new, but we are living for over a year in the conditions wrought by a global pandemic. So we're seeing how deeply broken this system is. And tonight we will look at healthcare in two parts. In the first half, we're going to be discussing what's happening on a federal level with the fight for Medicare for all. How did we get here and where can we go? And we are incredibly honored to be joined by activist and founder of Be a Hero and author, and my friend and hero himself, Ady Barkan, as well as Lori Kearns, who's the director of the U.S. Senate Committee for Health, Education, Labor, and Pensions, that subcommittee on primary health and retirement security. Then in the second half of the show, we will be talking about things closer to home. We're going to be talking about the current initiative in Vermont to expand state Medicare coverage and increase healthcare access. And we'll be joined by President Pro Tem of the Vermont Senate, Senator Becca Balint, and longtime healthcare advocate, Peter Sterling. And we're also going to hear from RAD's own New Hampshire healthcare justice organizer, Heather Stockwell, who's going to let us know about the work that's going on in the Granite State to raise awareness and build support for single payer healthcare. So I'd like to welcome all of our guests to the show. Thank you so much for joining us this evening and to shed light on this critical topic. Before I introduce my friend Ady Barkan, I wanted to share a special greeting, invite Dr. Savakor Kumabu Omie, who is an international disability rights leader, and she currently works with our partners at the Vermont Center of Independent Living, and she's on the Rights and Democracy Institute board. Seth, I will turn it over to you.
Thank you so much. Can you hear me? Okay. Thank you so much. I'm so much happy, especially to see Ady's face physically here, one-on-one basis. I'm so honored. My name is Afako Komabupumei. I'm a board member of the Rights and Democracy Institute. I am a policy analyst, international disability rights advocate, and currently working with the Vermont Center for Independent Living as the Independent Living Coordinator. One significant thing about me is I also have a physical disability. So I have a polio at the age of 8, and I love doing disability work across the globe. I'm originally from Ghana. So that is one unique thing I would like to throw out there. I wanted to say a few words about Ady and thank him for all he has done advancing the movement to healthcare justice, disability rights, and the choices for care and democracy. I learned of Ady's work through Rights and Democracy, and in the summer of 2018, VCIL co-sponsored an event in Bennington, Vermont, as part of his nationwide Be a Hero tour. That was when I got to know or heard about him. The impact you have made is impossible to measure, Ady, as you have not only raised awareness about some of the most critical issues facing our communities and help mobilize thousands of people to take action, but you have also raised expectations of what each one of us is capable of doing to win positive change. We are forever grateful for the gift you have given us with the example you have set. Your work building a movement for health justice and for universal system of care could not be more critical here, now, and across the globe. Your work is our work, and we are thrilled to partner with you and to have you join us tonight. Thank you, Ady. I'm so honored to meet you. I hope you enjoy us. Thank you.
Thank you so much, Seth, for that special greeting. And Ady, we've known each other. I think we met you back in 2012. You called me up when I was working with the Center for Popular Democracy, and you were actually one of the first people I told about the vision of launching Rights and Democracy a couple of years before we actually even did it. And I just have so much respect for you as a movement strategist, but watching you turn the tragic developments in your life into one of the most profound examples in the history of our country of what an individual leadership and organizing can do to advance collective struggles despite all the odds has been absolutely incredible. So thank you from the bottom of my heart for everything you do and for joining us today for this discussion about this critical moment we are in and how we can build the movement for universal health care in the short and long term. For folks who have not heard of Ady's story, we'll add links about the documentary Not Going Quietly that recently came out. Also just check out his incredible book, Eyes to the Wind, a memoir of love and death, hope and resistance. Or just Google his name and just be in awe of the movement hero who has made such a massive impact on our country and impacting elections. And then most recently, helping free the vaccine to tens of millions of people worldwide. Ady, it's our honor to have you join us today. As Seth said, it was great to have you in Vermont and New Hampshire. And just think about how far we've come and where we're at now in the spring of 2021, just over 100 days into the Biden administration, and are hopefully reaching the final phases of a global pandemic that has highlighted the failings of our healthcare system. And in our country is about to spend billions of dollars helping our communities recover from the economic and healthcare crisis. So we want to kick it off to you with a presentation so you can just let us know where you think we are at in the movement for universal health care and give us a little background on how we got into the current system we got. Ady.
Thank you for inviting me to have this conversation with you all here today, and thank you SEF and James for those extremely kind words. Please know I think the world of you, and am in deep admiration of what you have helped create here at Rights and Democracy. And to Lori, Heather, Becca, Peter, and Seebacher, I am honored and excited to be in your company today to discuss such a critical topic, which is our fundamental right to health care. As James mentioned, I was last in your neck of the woods during the summer of 2018 at the end of an amazing road trip that started in my home of California. We stopped in 30 congressional districts to help mobilize the country to fight back against Donald Trump and the Republicans to take back control of the House of Representatives. One of the last stops on the trip was at St. Peter's Episcopal Church in Bennington, which ended up being one of the last public speeches I ever gave without my computer voice. Some of you may know, but I have ALS, which is a terrible and mysterious neurological illness that has left me totally paralyzed, though I can still communicate with you all because of this miraculous technology that follows the movement of my eyes, which are the one body part that I am still able to control well. So you understand this topic of healthcare is personal for me. But before I get into where we're at in the movement for Medicare for all, I want to first answer your question, James, and explain where we've been. The short answer for the recent past is to hell and back, but because we have some time today, I'll give you the long answer. The quest for universal health care began in the United States at the beginning of the 20th century, as the field of medicine was quickly growing more sophisticated, with new diagnostic tests and surgeries. Most Americans paid their doctors visit by visit, but with the new advances, costs began to rise, tying health more directly to wealth. To address health disparities, the Socialist Party of America endorsed a national health insurance system as early as 1904. Then in 1912, President Theodore Roosevelt, who had previously served nearly 8 years as a Republican president, decided to run again, this time on a progressive ticket. Roosevelt's platform, supported by labor unions and suffragettes, called for the establishment of a centralized national health service, which doctors, businesses, insurance companies and conservative politicians branded as Bolshevism. The battle for universal health care continued, mainly in the academic spheres, until the 1930s, when health reformers proposed cautious and technical proposals for universal health care as part of the New Deal, but ultimately failed to gain grassroots participation in the effort and were defeated in the face of intense opposition from the American Medical Association. In the 1940s, a hint of grassroots mobilization arose when labor unions and health reformers united to push for the Wagner-Murray-Dingell bill that would have created a national medical insurance system. FDR's successor, Harry Truman, proposed the system twice in the years to come, but was once again defeated by the American Medical Association, which spent over $1 million on an anti-health reform public relations campaign. Rather than challenge the private insurance industry and push for universal health care head-on, progressives shifted strategy in the 1960s to help populations left behind by the marketplace. Cue Medicare and Medicaid, which each came into effect as part of L.B.J's Great Society campaign. Decades later, Bill Clinton rode into the White House promising health care reform, but relied on the same elite-based decision-making that dominated the health care policy space before, and for years to come. From those years came the Children's Health Insurance Program, and then of course we all remember Obama's enactment of the Affordable Care Act, which helped many people gain access to insurance, but too often at an unaffordable price, and with too many still left without coverage. And all the while handing over more power to the private insurance and pharmaceutical industries. So what can we learn from this history? I think it's best summarized by the healthcare historian Beatrix Hoffman, who said, "Public opinion has generally run in favor of healthcare reform, but popular approval has not been matched by the rise of a large-scale, activist popular movement for change. That's why I started Be a Hero. We need a movement for universal healthcare, which I believe can best be achieved by enrolling everyone in Medicare. Medicare for all as it is known, and as our good Vermont friend Senator Bernie Sanders popularized in his presidential campaigns, in my view, is the simplest, cheapest, and most equitable way to guarantee health care as a human right for all. Medicare for all, then, is our North Star, and this is the moment we need to work hardest and most concertedly in the direction of that star. I know many of you are tired. Fighting back against fascism for the past 5 years has been exhausting, especially for those who were targeted most directly by the ferocious racism, hate, and greed of Trump and his henchmen. But as many of us learned during President Obama's tenure, the work of building a more just society must continue after the election is won, lest the promise of democratic control go unfulfilled. If Democrats do not now deliver on their campaign promise to bring universal health care, I can assure you Trump's fascists will come back in 2 years, and we will lose our ability to govern. So now is the time to push for Medicare for all. The coronavirus crisis has proven how broken our healthcare system is, with thousands of Americans dead and many more facing bloated bills and long-term health complications from our system's failure to take care of people. People's frustration with the healthcare system is reaching a boiling point. 10 years ago, Medicare for all was a fringe idea, but now it enjoys the support of a majority of the American people and even more support among the Democratic base, where I believe Medicare for all can be a uniting issue. The progressive movement is stronger and more united than ever. I'll say it again for those in the back, now is the moment for Medicare for all. I can tell many of you, especially those on the eastern side of the Green Mountains, may be looking at me like I'm crazy. Didn't we already try for Medicare for all in Vermont and fail? That's true, and an unfortunate truth, but I believe a national movement for Medicare for all will be more effective at bringing about a systemic overhaul to replace the exploitative for-profit model with one that guarantees health care as a right for all. Vermont put up a valiant effort, but could not overturn the system on its own. That will take a national movement. I understand the forces we're up against. A slim majority, a racist filibuster, the largest and most powerful medical industrial complex in the world. It will be a fight, and perhaps a long fight, but I believe we can win if we bind together. Canada, Britain, Australia, and countries throughout the world are able to provide care to everyone in their country, but for them it too was a fight to enact universal health care, often a decade or more of tough battles against entrenched interest groups. We can wage these tough battles. And I believe we can pass Medicare for all in the next decade if we build a movement and force the political will to make it happen. Just this past month, the failure of political will in California stalled a burgeoning Medicare for all proposal there. I'll get into the specific campaigns Be a Hero is championing soon, but first I'll leave you with this pitch. The only way to build real momentum for this in the long term is growing our tent, and playing the long game of addition. We need to keep growing our movement for Medicare for all, and I'll do my part to keep doing that by sharing my story and bringing new people in. I hope you do the same. If we do so, I know we can win.
Thank you, Ady. That was super helpful and just powerful history lesson that you gave us. And we're going to build off that, talk a little bit more about the moment we're in now, and turn it over to our other guests in this section, Lori Kearns, as the director of the U.S. Senate, the Health, Education, Labor, and Pension Subcommittee on Primary Health and Retirement Security, which is chaired by Vermont's own Senator Bernie Sanders, who Lori previously worked for as his legislative director. So Lori, can you just build off what we just heard from Ady, laying out where we're at, and to help folks understand how we can help move towards universal health care. Senator Sanders has been, as Ady said, a long champion of this and helped really change what was politically possible and what we were talking about. And then House members, Representatives Pramila Jayapal and Representative Dingell introduced the Medicare for All Act of 2021. Can you just tell us where we stand in Congress and what you could imagine being the best case scenarios for the next couple of years?
Absolutely, James. Thank you so much for having me. Thank you to Rights and Democracy for all of the incredible work that you're doing, not just in Vermont, but really movement building across the nation. I don't thank you for making me follow Ady. Who can follow Ady? And all of that incredible presentation and really just all of the work that you've done. I would be remiss if I didn't mention the senator was just traveling around Vermont, and he was in Bristol, and he was reminiscing about the great series of events that you did there. And I know that he is grateful to you, Ady, and to you, James, for really just everything that you're doing. We truly could not do this without you. I actually can really build off of what Ady was just saying, and thank you for really laying out the history here. When we introduced the revamped Medicare for All bill in 2017 with that incredible rollout, people said to us, "So what do you think? Are we gonna pass this next year, couple years?" We're like, this is a long process. This is going to take time. I do think that probably about a decade might be correct, and we are well on our way. Again, and I'm going to keep repeating this, but thanks to all of the work that you and all of the activists out there have been doing to keep the pressure on, to keep people to know that this is something that people truly care about and that they want. This is not a flash in the pan idea that is going away anytime soon. What the senator is working on now is trying to build in any way he can to improve our healthcare system. And so you've heard him talk about this. He was thrilled with the funding that was in the American Rescue Plan for community health centers, which are so important in Vermont. We have the highest per capita use of community health centers in Vermont. The senator's very proud of that. The funding for the National Health Service Corps to help get providers into underserved areas. And he wants to keep building on that. He sees these next coming plans, the American Jobs Plan, the American Families Plan, really as the opportunity to expand health coverage to make sure people are getting the care that they need, but also that they're able to see the doctors that they need. And so we're going on two tracks with this. The senator wants to expand Medicare to at least 60, if not 55. And he really wants to make some really simple changes to Medicare that it's sort of incredible that we haven't done already. And that is to add dental, vision, and hearing benefits. I actually don't know the history of this, but it is absurd that your mouth is treated as a separate part of your body for purposes of health insurance. Why isn't dental just simply included with health insurance? And so we have so many seniors out there who never see a dentist because Medicare doesn't cover it, or who are missing all of their teeth because they haven't been able to get the care that they've needed throughout their lifetime. And so we really want to rectify that, make sure that Medicare is covering people's hearing aids, their glasses, these really simple items that you can't take for granted when they're not covered by your health insurance and will cost you hundreds, if not thousands of dollars out of pocket. And another thing that the senator is working on, and here I'm going to put in a plug for the hearing that my subcommittee is doing this Thursday, 10:30 a.m. We are doing a hearing on the shortage in our healthcare workforce. Because in addition to the fact that you have so many people who can't access care because they don't have the health insurance they need, they're either uninsured or underinsured, they can't access care because there are no doctors around to care for them, or nurses, physician's assistants. I say doctors is a universal sort of word for provider here, not excluding any others. And so, the senator is really working on efforts to expand the number of primary care physicians that we have in this country. We're facing a shortage of up to 55,000 primary care physicians over the next decade, and so it's not enough. Yes, if we win Medicare for all, absolutely, that is fantastic. But if people can't go see a doctor with it, it will not mean as much as it should. We need to make sure that people are getting the care they need. And that involves making sure that we have the workforce to care for the population. And when you factor in everything that we've been through in this past year with COVID and burnout and all of everything that our frontline providers have been through, this is the time to make sure that they are getting the resources they need, that people understand that when they go into a career in medicine, they are going to be supported. They are going to be able to care for their patients. They're not going to be stretched so thin because we haven't provided them with, truly anything that we saw happen this past year. Really just awful how we let down our healthcare workforce. And so those are sort of our immediate tasks at hand. Later this year, the senator will of course be reintroducing the Medicare for All legislation. That is absolutely something that we are committed to and will be pushing forward on. And we really look forward to continuing to work with you all to hopefully add more co-sponsors in the Senate and really make progress here.
Thank you so much, Lori. That was super helpful. In a minute, we're gonna bring on some other guests, talk about some of the work happening in New Hampshire and Vermont, ways to plug in. But we wanted to give both of you another chance to talk a little bit more about some of the specifics that, as you see the struggle in this country, what it means to things that we can actually do in New Hampshire and Vermont. So I'm going to turn it back over to you, Ady.
My team at Be a Hero has spent the past year organizing for home and community-based services. Last summer, when Biden Zoomed with me for the final interview of our healthcare series with Democratic presidential candidates, I asked him directly if he would strengthen Medicare to include home and community-based services. In the recent joint address to Congress, President Biden made a public commitment for a $400 billion investment for home and community-based care services in the upcoming infrastructure package. This is great news, and we need your advocacy and organizing to ensure that this bill is passed. This fight is deeply personal to me. I have an incredible team of 7 caregivers who provide me with 24-hour home care, and their work is what allows me to be here today with you all. Most elderly and disabled people who require full-time care do not share in my reality. I refuse to remain the exception. Even good health insurance does not cover the full-time care that living with ALS requires. Because of this, many others with ALS are placed in nursing homes where patients are merely maintained and isolated from their loved ones. And to be honest, I don't know if living in a nursing home would provide a quality of life that I would be willing to tolerate. Especially this past year, When nursing homes became epicenters of the pandemic, we witnessed just how deadly and dangerous they are. Disabled and elderly people who need care should be able to live at home and lead the independent lives they deserve. Having home care makes my beautiful and full life possible. I get to live at home where I can interact with my family every day. My two kids, Carl and Willow, can climb up onto my lap and we can have conversations or listen to music together. Home care allows Rachel and I to be partners and co-parents, instead of patient and caregiver. It also allows me to work closely with my team at Be a Hero to organize for a single-payer healthcare system. Winning the fight for home and community-based services would mean that millions of people, and their families, can afford to stay together. In addition to home and community care, we need to push for Medicare expansion. As we know, during the pandemic, millions of Americans lost their jobs, and many lost their health insurance with it. It just doesn't have to be this way. We already have a Medicare system that delivers health care to 60 million Americans. Why not expand it to include more people in need of care? Now is the time to lower the Medicare eligibility age from 65 to 50, and strengthen the program to cover the full body, eyes, ears, and teeth included. The majority of Democratic voters support expanding Medicare. 17 senators, including Senators Bernie Sanders and Elizabeth Warren, recently sent a letter to President Biden urging him to lower the Medicare eligibility age and expand the program to include vision, hearing, and dental care. But President Biden has not included these critical measures in the American Families Plan, and now it is up to all of us to hold the president accountable to his promise of universal health care. Right now in Congress, Bernie Sanders and Pramila Jayapal are fighting to cover people over 55 on Medicare, but they can't do it alone. This is where we come in. Medicare expansion is entirely within our reach and widely popular across the electorate. Healthcare will be a key issue for voters in next year's midterm elections, and will continue to be in the years to come. This means that we must engage in electoral organizing to elect progressives and to help re-elect Democrats like Senator Maggie Hassan in 2022, while pushing them to support policies like Medicare expansion and Medicare for all. We have seen how important it is for progressives to push moderate Democrats to support progressive policies. And we know that this political pressure works, especially when an election looms ahead. Biden is more popular now because of Bernie's push for direct cash payments. We have to do this with Hassan and others over the next 18 months. I want to leave you with one last call to action. In my activism, I have learned that all of us have a healthcare story to share, whether it's our own or about our loved ones. Join me and tell your story in your community and to your elected officials, because in sharing your personal story, you will help those around you make sense of their own. The more we mobilize and help elucidate the injustices that connect us all, the more difficult it will be for special interests to resist our collective power. I am grateful to you all at Rights and Democracy because you have been at the forefront of this national fight. We at Be a Hero hope to be a partner to you all so that we can turn these gains into a lasting reality. I believe we do this by spreading the vision of a future with Medicare for all, a future so irresistible that wherever our comrades go, they plant seeds of possibility. The growth we're seeing in this movement today are the fruits of your labor, of organizers past and present who believe that healthcare is a right owed to us all. Our hard-won progress gives me confidence that we will win this fight. And being here with you all today reminds me that we are closer than ever.
Ady, you are so inspiring. Thank you. We are just proud and excited to be in this fight with you. And thank you for that pitch to have people tell their stories. We've seen that. That was a huge part of the effort in Vermont. And, I think everyone knows this. This is how we understand the world, the stories. And it's just so incredible. Your story is powerful. And you're right, everyone has one. It's powerful. Lori, we're going to give you another shot to pitch what people should do. What should we do to stay involved, stay up to date? What's happening?
Great. I think that there are, as terrible and as tragic as this past year has been, and it's been hard on everyone, but there have been parts of it that shown that we can do this if we actually set our minds to it, if we actually want to do it. You know, here in DC, they set up free COVID testing at firehouses across the city, and you would just walk up and you would get tested, and that was it. There was no cost. They didn't check your insurance. So many of us now have gotten vaccinated, and you know, either made an appointment, or now in many places you can just walk up, you get the shot, that's it. They don't check your insurance. It's free. You're not charged for anything. And so we can do this. And so many of the obstacles that we keep running into are people who just simply either cannot imagine a different way of doing things. There's just so much inertia built into the system of, well, like, of course nobody would create this system if you were doing it from scratch, but we're not doing it from scratch. But we know how to do this. And we just have to keep pushing that this is possible. This is not a pie in the sky idea. This is not crazy. This is entirely within our capabilities to do so. We just have to decide we're going to do it. You know, the New York Times had a piece today that was a thing that said that it was showing the reasons why people who haven't been vaccinated yet haven't been vaccinated. And there's a sizable number of people who say that they have not been vaccinated yet because they're worried there's going to be a cost associated with it. And that is so heartbreaking to me, that we have built this system where people simply cannot imagine that they will not wind up being charged for the healthcare that they get. And it doesn't have to be that way. And I don't actually really have much in concrete steps to add to what Ady has already laid out so well, but just to keep pushing and to keep showing that this is possible. We can do this. We know how to do this. We just have to decide that it's what we're going to do.
We got to decide it's what we're going to do, and we're going to change what's possible. Thank you so much, Lori, Ady. I can't thank you enough for sharing your story and joining us tonight. We're just thrilled to work, with both of you and your teams to build this movement. And so we're going to actually pivot to talk about that, about organizing in our communities to create change. Ady laid out how important New Hampshire is in this federal fight that we heard. So we're going to turn it over to our New Hampshire healthcare justice organizer, Heather Stockwell, who's going to talk about some of the stuff that's happening right now in the Granite State. Heather.
Hey, y'all. Thanks so much for having me tonight. And I so appreciate your words, Ady. And I was on that tour when you came through New Hampshire in 2018 and met you then. So yeah, just a couple of weeks ago, less than 2 weeks ago, our New Hampshire healthcare justice team hosted a really terrific event, an online event, which outlined many of the facts, the need, our history that actually Ady just went through, and our strategy for getting to a Medicare for all single payer system, and how COVID-19 has illustrated that need more than ever. Like, we're literally relying on our neighbors' health for our own health because of the interconnectedness of all of us. And in a time that, at the same time, we have this virus spreading rampantly across the country. And I'm personally concerned about the folks that are getting COVID, have to be hospitalized for any period of time, because I fear that they're going to be facing enormous bills when they return home. We just had a story here where the man on our local news said he was going to be, his bill is going to be $100,000 for his stay. And many of those folks are more likely to have longer term conditions and things too. So they may need even more care in the coming years. And our healthcare system isn't really addressing our regular needs, as we've all talked about. So we're in a situation here in New Hampshire where we pay some of the highest insurance premium rates in the country. Just a few years ago, and I think this was 2018, we saw rates across the country increase by 25%, while New Hampshire rates rose by 45%. So New England in general has really high rates. Meanwhile, not one of our federal delegation members here from New Hampshire are co-sponsors for this legislation. We have asked a number of times for them to co-sponsor. So our strategy is a little bit different because now we're asking our members or urging our members to sign a patients over profits pledge, because they are taking donations from some of the same companies and organizations who are working against us. And if they aren't working, they aren't working against it because they genuinely don't think it's a good idea. It's more because they stand to lose their source of income for themselves and their shareholders. And those incomes are in the millions and millions of dollars, multiple millions of dollars of salaries. So one of the key things we've been working on is research. We're looking at how the corporate money influences our healthcare industry as well as our delegation members. One organization I don't know that was mentioned tonight, but the Partnership for America's Healthcare Future has been actively working against any universal healthcare efforts. And their main support comes from the industry itself, again, to protect this cash cow, which is also known as we, the people. So we must move away from a healthcare delivery system model that does not, that monetizes people and the conditions or illnesses they have. So some of the key things we're working on too are education campaigns, right? We're looking at who those key groups or constituencies are that aren't really being organized yet or aren't necessarily totally on our side, right? So for instance, the business community, they actually stand to save some money here and that they could be putting into salaries or expanding their business in different ways. The elderly community, we have a really high population of elders in this state, and they're often some of the ones that don't realize how much they stand to gain from this new kind of system. And healthcare workers in New Hampshire, we don't have a nurses union or association here in the state, and actually Maine, right next door to us, just started their first nurses union ever. So there is hope, and we're working on just expanding our base, like Ady was talking about before. We've got to add numbers. We can't just keep preaching to the choir.
Thank you so much, Heather. And you're not doing this alone. You have a team. You have a New Hampshire Healthcare Justice team, and people are getting involved. They're telling their stories in the way that Ady was talking about. But can you tell us now, if somebody sees this video, is watching now, sees it, how can they get involved? What can they do? People are busy. What's the fastest way to get involved and plug in?
Right. Well, yeah, that's a great question, James. We have a Medicare for All petition that lives on our website. I think somebody's going to post that into the chat right now or within a few minutes. And there you can sign our petition. We already have over 2,500 signatures, but the next time we go back, we need to be sitting down and having 4,000 or 5,000 signatures. So sign this petition, share it with your friends and your family, so that we can and help us get there, because we need to show them that the support really is here, and that's one way you can do it. And on that petition, there'll be some check boxes. You can sign up to do things like help out on the campaign. You could join the core team. You could join the research team. You could share your healthcare story, as we were just talking about earlier. We're also doing this campaign this summer where we're taking the slideshow. We're going to have canvases and text banks and phone banks over the summer too, but we're packaging our slideshow, our presentation, into a toolkit kind of format, so that if you want to host your own house party just with your own sort of close friends or family members or work friends, whatever it is, you could do it virtually, you could do it in a small group in your backyard, and use those things. We'll even help you plan it all out. And this is like a sort of living room campaign, right? This is how we're going to change people's minds. The people that aren't maybe going to come to that big event or get politically active until they know a little bit more. So that's the first thing you can do, and it's really easy. If you want to take it a step further, I would urge you to do this next action. It's a patient's, it's basically a click to email action. You'll put in your zip code and maybe a little bit more information, and there'll be a pre-written email that comes up. In that pre-written email, I encourage everybody to add your own sort of personal note to that. And let them know your own thoughts, because oftentimes they get those and they go into the rubbish. Basically, they don't really look at them. So make them a little bit personal, and basically what you'll do is you'll put your zip code in, and your representatives will come up, and you'll be able to send that email to them in a matter of like minutes, right? And that will urge them to sign this Patients Over Profits pledge, which is asking them to stop taking the money from those corporations that are essentially working against us. The lobbyists, the PACs affiliated, all those people that are working against Medicare for All or a single payer system. So this is an important step forward, because it really puts the patients first, and the profits last. So let's get our delegation to sign this pledge. I think it's the first step moving forward.
Thanks so much, Heather. We heard some stuff from Ady also about some possible New Hampshire fights coming down. So lots to do in New Hampshire, and also lots to do in Vermont. We have our final guests going to be joining us to be able to talk about what's happening in Vermont. It's very interesting because it's very connected also to what's happening that we heard about from Ady and Lori about what's happening on a federal level. And so I'm super excited to introduce Senate Pro Tem, Senator Becca Balint, who is a champion of this in the Vermont Senate, and will also be joined by Peter Starling. But wanted to kick it off to you, Senator Balint. We're so excited for you to be here. Can you just give us a brief overview of what's happening in Vermont and what people should know, and you know, any of the context that you want to report tonight? Thank you so much again for joining us.
Thank you, James. Can you hear me all right?
Yes, I can.
Okay, great. Well, it's really such an honor to be sharing the virtual stage with Ady. Such an honor. You have given so much to this nation through your dedication to this work. And I was so delighted to be able to hear you speak to all of us tonight, and such an inspiration. I want to really start my remarks tonight with my own short healthcare story. It was just about 13 years ago, and I was home from the hospital with a newborn, our first child. I'd had a really rough delivery and was recovering from an emergency C-section. And I was very lucky because I gave birth to a healthy son, Abraham, and I was fortunate that I was also in good shape for the most part, little beat up, but for the most part, healthy. Like so many new parents, all I wanted to do in those first few weeks and months was to simply rejoice in Abraham. All of his mannerisms, all of learning that I did in watching him and seeing myself grow into the role of being a parent. But instead, what I remember about that time was being on the phone for way too many hours, arguing about the hospital bills and what the insurance company would or wouldn't cover. And the bills were incredibly complicated and they were confusing, and I was sleep deprived and I was tender, and I deeply resented the amount of time spent justifying the expenses on the hospital bill and why the company should cover them. And at one point, the claims adjuster tried to argue with me that the anesthesia used for the C-section was optional. And it was an absolutely absurd conversation. And it was eventually clear to me that somebody at the hospital had miscoded it, which we've all been through at one time or another with our healthcare system. But it's just wrong. There's just no other way to put it. It's just wrong. Nobody should have to fight with an insurance company when they're trying to heal. But I was lucky. I didn't go through bankruptcy. I didn't forego much needed care, as some of the other speakers talked about earlier. So we all know that healthcare in this country is not really a system, and it's really not working. So I want to remind all of us of the political context of this important discussion. And I know James touched on it at the beginning. You know, many of us here in Vermont are still feeling burned from Vermont's experience exploring single payer healthcare. And it's easy to get really down, and it's easy to feel frustrated and easy to lose faith and hope that we can actually do something. But we know that Vermonters are still feeling the impact of lack of affordable healthcare. So we don't really have the option of giving up. So, you know, just this weekend, I was answering emails from constituents, and I got a heart-wrenching email from a constituent who had just literally retired, recently retired, and the next week found out she'd been diagnosed with cancer. And her insurance premium and her deductible had increased over the last few months so dramatically that she didn't know how she was going to swing it. And she asked me, she said, "What am I supposed to do? I have cancer. I just retired. I'm supposed to be enjoying my life. And now I think I'm going to have to go back and get another job while I'm sick to pay my health insurance bills." And that's just a sick place for us to be as a nation. So we all know we have critical work to do. So our goal has been to rebuild, really start to rebuild the political will for healthcare reform in Vermont. And recognizing that we can only do this, as others have said before me, in a partnership with the federal government. So the good news is, as Ady mentioned, we are not living under a horrible fascist dictator anymore. And we have a unique opportunity with this new administration. So the Vermont Senate had a goal this session to sort of jumpstart the public discussion on this. And we want to understand the long-term trends and out-of-pocket costs here in our state. We want to better understand the impact of COVID-19 and disparities in healthcare access. And I think part of this conversation that I have to bring into it is that, got to state the obvious, which we're a citizen legislature, and we don't necessarily have the expertise that we need to tackle these really complicated issues. So we need to dedicate some time and effort and money so we can be better prepared for possible changes and opportunities that are to come. And I know Peter Sterling's going to touch more on what he sees as those opportunities. So I don't need to tell you, we've been through these 4 terribly dark years, and the previous president was so hard on our nation on so many fronts. But the thing that I've been thinking about lately is that with a new administration comes an opportunity, not just to like breathe again, but to actually allow ourselves to dream again, to have a vision of what we might be able to do. So we want to understand the opportunities that we have with the new administration. We want to know, can we expand access to affordable healthcare through existing public healthcare programs, as you know, others have talked about on the call here tonight, you know, ones that actually address the unmet healthcare needs of our Vermonters and of our employers, because they're stuck in this horrible system as well. So we're going to delve into the findings and recommendations from previous studies and analyses that we have already done, that we already have. And we're going to set aside money for a task force that is going to be made up of legislators who can work with a consultant to answer these questions, so that we're ready as we head into the next session to have a punch list of things that we can get done. We have to increase the brain trust in the legislature first and shore up our knowledge around healthcare issues. So the good news is that there's consensus, I feel like, consensus among Vermonters and among legislators that access to affordable healthcare is one of the most pressing needs that we face. It's one of the things I hear about every 2 years when I'm out on the campaign trail. It's unaffordable. It's crushing us. It's making it impossible for families to save money, and we're all deeply worried about our health. So we cannot squander this opportunity that we have. Now, the other thing I want to make explicit is I know that some of my colleagues, as I was talking about sort of jumpstarting this process, have been feeling concerned that we're going to set ourselves up for failure again. And that feels, frankly, like crap when you're working hard and you think you're on your way to a solution and then it falls apart before your eyes. So we have to be reassuring each other that we must begin this fight again. It isn't wasted time. And the healthcare reform puzzle doesn't fall squarely on our shoulders in the Vermont legislature. We have to partner with the federal government and with our governor. So my hope is to get us back into the conversation. Okay, we've been out too long. We got back in the conversation, back into the public arena, working with external partners like you at RAD. I can always count on you at RAD for like boosting us all up and doing the hard work. So we're going to do our part in the legislature. We're going to partner with people like Peter Sterling on the outside to help us stay focused. But we also need all of you in this fight with us to keep pushing us on this issue. So James, I think I'll end there, but I just want to say that the time is long past due. For those of you who don't know me well, I actually wasn't born in this country. My dad's Hungarian by birth, and he fled here after World War II. And I was actually born overseas and in his mother's hometown in Germany. And we talk about it all the time at my dinner table. My son always asks me, he's 13 now, Abraham, he always asks me, isn't it just crazy that we don't have universal health care? When are we going to get Medicare for all? So I'm bringing Abraham with me tonight. So thanks, James.
Thank you so much, Senator Balint. And it's just exciting that Vermont, for those of us who worked a long time to try to move Vermont to help be that first domino to help bring universal health care and got so close. It's so excited to have your leadership to be able to bring this back up because, like you said, the healthcare crisis has not gone away and we have a lot of work to do. We are, I'm going to turn it over to Peter Sterling. Peter and I were recently both asked to testify in the Vermont House Committee on Healthcare back on May 5th. I think we put the link to that testimony in the chat. But Peter, can you talk about how important this policy is as you see it? You're someone also who's been just organizing for universal health care for well more than a decade. Lay out where we're at with this with the initiative.
Well, we've had some stars align. I mean, we've got Senator Bernie Sanders down in DC really creating the space about a conversation around why we should be expanding access to affordable healthcare. And first, let me back up and say, Ady, Lori, and Heather, so many thanks for all the work you're doing. I don't think we're doing anything here in Vermont without people like you doing what you're doing elsewhere. I mean, really is super important. But with Bernie creating that space to talk about affordable healthcare, and not in the way, the corporate way that Obamacare was or Clinton was doing it, right? I mean, Obamacare is essentially public tax dollars going to subsidize private insurance through a healthcare exchange. That's not going to work. We have that leadership in DC from Bernie doing it. And I got to say, we have leadership here in Vermont from Senator Balint. She kind of underplayed her role in the conversation. I mean, she has been working pretty much every day this session to get the language through the legislative process to make sure we can have a conversation about what it would mean to get more Vermonters affordable healthcare by expanding our public healthcare program. So without leadership at many levels, in particular, from Senator Balint here in Vermont, I wouldn't even be here talking to you all about this because there'd be nothing really to talk about. So can't say enough about the hard work Becca put in every day to make sure that this language happens. And so, as Ady has particularly talked about, we've tried a bunch of different reforms before, in DC and even in Vermont with single payer, which was doing everything at once. And, with healthcare taking up about 20% of Vermont's gross domestic product, I think it became clear to a lot of us that doing it all at once would be very, very difficult. And it's a big lift. And Shumlin failed, because he wasn't able to control costs and it was creating a lot of anxiety, but it's a big lift. But with Bernie and some key players in the Biden administration being very open to an age-banded approach to expanding access to an affordable public healthcare program, I think the stars are really aligning because there can't be anyone out there who says the current system is working, right? In Vermont, I don't like to use too many numbers, but I got two I got to throw in there. 40% of Vermonters are now underinsured. I mean, And it's not just low-income Vermonters. If you're a family of four on the healthcare exchange, which, you know, a lot has been talked about how great it's subsidized, family of four making $105,000 now has an out-of-pocket limit between prescription drugs and other medical costs of $28,000 a year. That's 26% of their income before taxes. As we know, no one pays their bills out of the paychecks before taxes. That's after taxes when the bills come out. So that 26% is clearly a lot higher. Should that family of four reach its out-of-pocket limit, they're probably looking at, you know, a third to 40% of their income going to healthcare costs. And that is just not sustainable. There's no way to make that right using the private insurance model or the exchange. The only sustainable way we can really get Vermonters and Americans, I believe, affordable healthcare is by expanding access to a public healthcare program. Medicare is very much a federal program and probably not something that can be expanded on a state by state level. That's very much a federal benefit program, much like Social Security. But Vermont has had a long set of successes in expanding access to Medicaid. We have what I would probably say is one of the most successful, if not the most successful, public healthcare program in the country, and Dr. Dinosaur, which is, it comes with dental care. It has no out-of-pocket costs, incredibly low premiums ranging between like 10 and 20 bucks a month for the family. I mean, there isn't any Vermonter that I've heard in my 15 years of doing outreach, I was a navigator, who ever complained about Dr. Dinosaur. You know, we have 96% coverage of young people. So, you know, we have great examples in Vermont of expanding access to Medicaid, providing affordable health care. And I think as the pro temp pointed out, you know, we need to start the conversation here in Vermont now about what it would look like to expand access to Medicaid by, you know, through an age-banded approach, to be ready to work with the Biden administration on how to make that a reality. Because I got to just reinforce, even though a couple people have said it, it really is true. And for those of you who don't know me, I'm pretty liberal, right? I'm willing to tax pretty much anyone for anything, but no, there just simply isn't enough money in Vermont to fund a real healthcare reform effort by ourselves. We need the federal government's willingness to allow us to use Medicaid dollars, to allow us to use exchange subsidy dollars to make healthcare more affordable. So we have to be ready to work with willing partners in DC to make a significant expansion of Medicaid possible. And one of the ones I think some of us have been looking at, including the pro tem, gratefully, is what would it look like to simply make Medicaid available to every Vermonter who's age 50 to 64. So as they run up into Medicare and as they get on later in life and you have more healthcare costs, what would it look like to take those 113,000 Vermonters, which is about a third of the private market, and let them access Medicaid starting at age 50 to 64 or 65. And certainly if the federal efforts are successful to lower Medicare eligibility to 60 or in 55, Vermont could still continue down that path and lower it to 50. And to me, if we were successful, or when we're successful, you know, if we basically have universal coverage from 19 and below through Dr. Dinosaur, and we have universal coverage through Medicaid and Medicare 50 and above, it's only a matter of time before we shrink down those age bands and get everyone else in, and we'd have a truly universal, publicly funded healthcare system close to single payer. But the one thing I just also have to say, in my experience, having been part of the team that helped pass Catamount Health, which has income cliffs and other public, it was a public program from a long time ago, and VHAP, and having been a navigator in the exchange, it has to be universal. That's the key thing. Any expansion has to be universal. There can't be income eligibility. There's too much churn. It's too confusing for consumers. Whatever we do has to be universal, available to everyone.
Peter, thank you so much. That was super helpful and super inspiring. Thank you both, Senator Balint and Peter, for your leadership on this. We're going to make sure people stay tuned on developments and work with Vermont NEA and other partners that are stakeholders in this. Really appreciate you joining us and are excited to be able to partner with you moving forward. So thank you so much.
Thank you, James. Thank you so much.
Thank you. So we've come finally to the end of our show. We've had incredible guests, but thank you all for joining us and tuning in to another episode of The Traverse, our conversation series brought to you by the Rights and Democracy Institute, which was founded in 2016 to advance human rights and strengthen our democracy through grassroots organizing, transformative policy in supporting the development of a new generation of leaders from rural communities across Vermont and New Hampshire. You can visit the website at rightsandemocracy.org to donate or sign up, and also stay tuned for our work at future episodes of The Traverse. Thank you so much for all of our incredible guests. Thank you for our comms whizzes, Franzi Thurman and Annie Swartz, and all of our guests, and look forward to seeing you next month. Thanks so much.